Hello, everyone, and thank you for joining us today. We're delighted to be able to speak with you today. Uh, my purpose in joining this is to talk to you about the LAO and just share a little bit of information about myself. Um, my story basically is I was diagnosed with breast cancer, triple negative breast cancer, back in 2014. And I went through lumpectomies and had all of my lymph nodes removed from under my right arm, which followed with chemotherapy and radiation. And then, not knowing much about lymphedema, I was then diagnosed with it in February of 2015. But the positive message that I want to bring to you today is that I am 8 years out, and I consider myself very lucky to be in this position. This is something that, everyone has to deal with. You don't expect it. You may not know anything about it, but lymphedema is a chronic, lifelong condition that requires management, treatment, compression, nutrition, and exercise. There are other ways that you can get this as well. And you can have it from birth, so primary lymphedema, and you can also get lymphedema after surgery or accidents or any trauma to the body. This is another important slide, and this slide is actually a little bit dated in that we don't have any research since about 2016. There's over 1 million people across Canada that have lymphedema, and there's over 400,000 in Ontario. I started volunteering at the LAO to try to make a difference based on my own experience that there wasn't any help for patients with lymphedema, and treatment can be very expensive. So 2 things I wanted to do to share: early diagnosis is critical. So you need to be aware, you need to educate yourself and become an advocate for yourself. Once I joined the LAO, I wanted to try to help other people who couldn't afford to pay for treatment, because that's a big part of managing your condition. So we launched the Compassion Fund in September of 2020 to give people with limited funds assessment and 2 or 3 treatments with a trained CDT therapist. And one of the pillars of that program was to teach you how to do it yourself. So you get at the initial stages, perhaps 2 or 3 treatments, you get some training and education on how to do this yourself, so you can handle it yourself going forward if you can't afford to pay for treatment. Part of the program here is that we launched in September a garment program as well, because some people, while they have support from ADP and are asked to wear garments, they can be very, very expensive. And so we are trying to help with that program as well. The program is just being started. We have some inventory, and we're trying and giving that out to patients that need the help. Of course, like everything else, there's a process and an application form, and you can find this information on our website. This is our website. You can call the number for info line, or you can look the information up yourself. We have a lot of resources. And finally, what can you do to help? Please join us to help advocate, to volunteer, and to donate. And we're always looking for volunteers. We do not get any government support. So whatever we have within the LAO is through memberships and donations. Thank you for your time, and I'm going to hand it off now to Adriana to tell her patient story. Adriana is on the board with me at the LAO. She came as a volunteer. She's a patient herself, and she's going to share her story with you today.
Hi. I will go very quickly over my experience with cancer and lymphedema. We can go to the next slide, Dolores.
Yes, Adriana.
Yeah.
There. Oh, sorry.
It's
Just
okay.
give me 1 second.
So that's okay. I will talk about it so that we don't waste time. So experience with cancer, first of all, as opposed to Dolores, who got treatment right away, I had to wait for a year until I got even a diagnosis of cancer. It started with one specialist telling me from an ultrasound that there was something there, and of course I started that process. It definitely shouldn't have taken a year, but it did. It was in 2016 I started the process, and I got surgery in November 2017, so exactly a year, minus a few days there. So yeah, that's what it is. But I was lucky in the sense that it was non-aggressive cancer, so it didn't create any issues. I didn't have any symptoms at all. I mean, if anybody asked me, I was fine just the day before surgery, so no problems there. Of course, I only had surgery, no radiation, no chemo, and they removed 32 lymph nodes. I had a full hysterectomy with that. Lymphedema, I discovered it overseas. I was forewarned that it is a possible side effect of the cancer surgery, but there was nothing I could do. So in any case, in the summer of 2019, so 2 years after, a year and a half after surgery, while overseas, I discovered that my ankles were swollen, with the right one being way more swollen than the left one, and some eczema developing on them. Didn't know about cellulitis at the time. It wasn't identified as such over there. I was told that it's circulation deficiency, not lymphedema. And then when I came back to Canada, about 3 weeks after that wonderful discovery, I was repeating the blood test and everything. Circulation was ruled out, so it left lymphedema. And at that point, I got a request for an appointment with a specialist in Kitchener, where I live. That materialized after a 16 months wait because of COVID. It wasn't a good prospect to wait for 16 months and do nothing. So I started searching on the internet. As I said, I knew lymphedema was a possibility. I started searching. I found a therapist. I found FITA. I was able to identify the LAO, and I listened to some webinars and stuff. I paid for them, and then I realized, well, a membership makes more sense, way more sense. So I became a member. Eventually, I got my appointment with the specialist with a local specialist here in the KW Guelph area. And this is what my lymphedema looks like. So, of course, I asked about it and what are my options to have it diagnosed. Like, what he did was just a touch and look type of assessment. He told me that there are no other options in this area. He told me that I have lymphedema in both legs, and he also told me that the difference on the upper side between the left and right is not lymphedema, which was a little bit concerning for me. But anyways, I didn't have any other options. So time flew, and I will go to 2023. So in between, all I did was a regular, visits to the therapist and wearing compression and stuff like that, because I didn't know any better. So comes 2023. I was able to visit Dr. Charnota at Sunnybrook, and he was very kind to accept me as a patient, and I had an ultrasound done, which confirms that there is lymph accumulation in my right side, and the circulation is fairly good on the left side. So obviously lymphedema in my right leg was confirmed. And very important to me, I have to mention that it made a huge difference to talk to somebody who really cared about lymphedema and was able to diagnose. I mean, even though I was myself convinced, and I talked to Anne, and I go to her for therapy and everything, and she told me, yes, it is lymphedema, and I have a local therapist as well that I visit, but it makes a difference when you have a problem to have a physician confirm what it is and talk to you about it. So I couldn't be happier that I had the chance to meet Dr. Charnota and the staff at Sunnybrook, because they were very supportive, and I really appreciate that. Now, later on, I had my surgery at London Health Centre. So my surgeon referred me to Dr. Simpson at London, Victoria Hospital. He's a plastic surgeon, but he does lymphedema anastomosis surgery, which I didn't know at the time. I was referred to him just again to diagnose lymphedema, see where things are going. Now, London eventually received this LSG scan about, I would say, 2 months ago. So I've been waiting for this appointment again for about 1.5 years. I got it only a few weeks ago. I had this scan done. It confirms the same things, that my right leg has issues. Left leg was fine. Circulation of lymph was fine in my left leg. And I also found out about the surgery itself. I found out that I'm a good candidate. Unfortunately, I cannot do it right now. I will have to wait until the fall. But again, it was very nice talking to Dr. Simpson and his staff. It was very nice, you know, feeling taken care of. It's a reassurance. I cannot emphasize how important it is for a patient to know that you have a physician who understands lymphedema, who knows what they are talking about, and who can take care of you. And until 2023, I didn't have that chance. Unfortunately, as I said, my family doctor is not a specialist in lymphedema by any definition. The other people that I talk to, I have some doubts about their interest in lymphedema. So next slide, Dolores, please. So what I do for my lymphedema, what everybody is supposed to do: daily massages, compression, and sleep or relax with my feet elevated. I cannot say more about having a licensed, knowledgeable therapist. I'm very happy to be Anne's patient. I mean, it's not only the therapy itself, but it's her knowledge and you know, her continuous effort to get information about lymphedema to help her patients. I found Anne via the LAO directory, and I'm very happy that I did that, and I'm very happy that I joined the LAO because it really helped me a lot. In terms of activity, I go to the gym, I go to aquafit, I go for walks. Nutrition, I cook my meals, so I reduce fat, I reduce sugar, trying to eat healthy. And the last one and most important for me is knowledge and advocacy. I cannot stress how important it is to keep up to date with the latest developments and get involved, and LAO is a great option for both. As Alois mentioned, I'm a director with LAO. I deal with advocacy there, and I'm very happy to be able to do that. So my last slide, please, Dolores. So lessons learned, because there were a few see the good side. I have to see the good side. I'm a cancer survivor past my 5-year mark. My lymphedema hasn't changed in the sense that my circumference in the right leg is more or less the same as it was when I discovered it. And it doesn't hurt, create ulcers, so no other issues. Second thing is that you have to take responsibility for your own health. So again, I had to insist to get my cancer identified. I had to insist to get an appointment to get the lymphedema diagnosed. It's not straightforward. It should be, maybe, but it wasn't for me. So you have to take responsibility for yourself and insist when you don't get what everybody should be getting, proper care. And then it's advocacy. And again, I am the advocacy director with LAO, and I think it's important for everybody to talk about lymphedema. People don't know about it. Some physicians don't know about it at times. It's, how do I put it? It's covered under the rug disease. Maybe people know about it, but because there is no cure, they don't necessarily talk about it. They don't identify it. There is a question if there is a code for doctors to charge OHIP when they deal with lymphedema. I don't know if there is. I don't know if they are aware that there is such a code. So it's very much undiagnosed. I'm sure that there are a lot more people than we know of who suffer from it. And so for anybody involved willing to talk about lymphedema, it's a bonus for all of us suffering from this condition. And that is pretty much all I wanted to talk to you about.
Thank you so much, Adriana, for sharing that. And Anne, we'll have you queue up your slides for the next part of our presentation.
Do you see my slide?
Yes, not full screen yet, though.
Okay, perfect. Great. Okay, so I'm going to talk to everybody about lymphedema management. I'm the clinical director, as you know. This is my presentation about lymphedema management and prevention. And the last slide, you'll be able to contact me if you need to with any questions or anything that maybe hasn't been addressed or concerns that you have. Please know that you can reach out to me. I enjoy hearing from people after the presentations because I know that people need a good source of information and sometimes just have questions they don't feel comfortable asking or questions we don't get to. So this is first the picture of the body. The gray little nodules here, they look like little pea shapes. Those are all lymph nodes. You have 500 to 600 scattered throughout your body. Major lymph node basins are in your neck, in your underarms, around all of your organs, and on the tops of your thighs. And so it just proves the lymphatic system is so extensive. And then all those lymph nodes are connected to lymphatic vessels that are basically distributed throughout your entire body and draining around all the tissues and cells and organs in your body. And this, again, is another sort of simple picture that shows on my right-hand side and everybody's right-hand side that the heart is pumping all that red blood towards all your organs and tissues. We get some fluid that leaks out. We get fluid that continues on through the veins. Whatever doesn't leak out from the circulatory system at the arteries will just carry on through the veins and return back to the heart. But everything that leaks out, which is about 10% of your body's fluid that leaks out, is all picked up by the lymphatic system, which is that green little system in the middle. It almost shows them as unique, independent things here, but they're not unique. They're completely intermixed and intertwined. And the lymphatic system is constantly removing fluid from your body. And it removes about 1 to 3 liters of fluid around your body all day and circulates it back up towards your heart. So it is an extremely extensive network. And this shows just how close the lymphatics are to your arteries and your veins. So the red again is your like arterial that brings the fluid down towards the skin cells. The blue is the vein returning it back to major veins and bigger vein trunks. And that little green thing in the middle is the lymphatic vessel. And that is what it looks like all over your body. It is completely intertwined, this complete network like a spider web. And it is so extremely important. So the functions of the system is it transports these large proteins that leak out from the arteries. So large proteins that cannot fit in the veins, and it removes other large molecules and water back towards your vascular system into the heart. It clears debris and toxins. It circulates lymphocytes, which are part of your immune system. It helps in the removal of waste materials, and its main role is as your check and balance to make sure that you never swell. If you have swelling after surgery, swelling after you fly, swelling after you do exercise, or swelling that's lymphatic swelling that's sat there for more than 6 months after you've had cancer treatments, that means that your lymphatic system is not able to do what it is designed to do. And so it isn't being that check and balance for your system, and you're getting some swelling. So it really is there to make sure you never swell and to remove any swelling around any of those organs or tissues or joints. Other functions, it really does, it goes beside that vascular system, like I said. It removes 100% of the fluid from around the cells that's leaked out. And it does all of this removal by contraction and relaxation of the lymphatic vessels. And really the lymphatic system, the vessels contract and relax at about 5 to 10 beats per minute. So it's not controlled by your heart. Your heart is beating blood through your arteries and veins at 60 to 100 beats per minute. So that low contraction means that it is a very slow and sluggish system. When you have damage in the area, we have to somehow stimulate that lymphatic system. That's what I'm going to talk about when I get to treatment. But we stimulate those lymphatic vessels so that they can contract and relax a lot more. But your muscular system and also deep breathing, so walking and exercising and taking deep breaths, can also stimulate contraction of those lymphatic vessels in the area. And then it's important to know that the lymphatic system, the vessels, as well as the lymph nodes are compromised when you have cancer surgeries, when you have dissection of axillary lymph nodes, sentinel lymph nodes removed, or radiation to the tissue. And so lymphedema is a swelling of, it's an abnormal swelling of a body part in the area with a collection of lymphatic fluid, which is again, that high protein rich fluid. It can be present in any area of the body. So it can be present in the arm, the leg, the remaining breast tissue, the stomach, the groin, genitals, head and neck area. So it really, the area of presentation for the lymphatic fluid will be in the area that is damaged by your cancer treatments and cancer surgeries. So let's give an example. If you've had an axillary lymph node dissection because of breast cancer, you're not all of a sudden going to develop leg lymphedema secondary to those lymph nodes removed. The area of swelling when they do axillary lymph node dissection can be in the upper neck area. It can be in the arm on the affected side, in the breast tissue, or in the back on the affected side. And it really is the most important chronic complication after axillary lymph node dissections, and it does have this tendency to progress. So it's really important if you've had axillary lymph node dissections or even deep groin dissections, it's really important to know, that you are at risk, and then to know what the warning signs are, so that you can take steps to try and prevent the progression of this condition. And if you have lymphedema or think you have it, then it's really important to get some advice and some management, and potentially get into a compression garment so that you can prevent its progression. And we do see it at a rate of about 23 to about 38% with axillary lymph node dissections I would say this is an incident rate from a research article. In clinical practice, we actually see an incident rate a lot higher than that when there's axillary lymph node dissections. So we are seeing high rates of lymphedema in people who have these dissections. And it does affect about 15 to 20% of all cancer patients along the course of your life. So the risk is not an immediate risk, but you do have the risk for the rest of your life. So if you live 30 or 40 years after your cancer treatments, you can still develop lymphedema at any point in time. And so it's important if you do have an unusual swelling in the area where you've had lymph nodes removed or surgery, that you bring that to the attention of your physician so they do the proper investigation, and then hopefully fall upon the correct diagnosis of lymphedema. But the risk factors for lymphedema, it depends on the number of nodes that you've had removed. So 10 or more lymph nodes is often higher risk factor. The extent of radiation. So if they've done radiation in 4 radiation zones, if they've done it into the collarbone and neck area, as well as the underarm, and also in through the back and the anterior chest, you're at higher risk. And then more number of radiation sessions that you've had can also increase your risk. So some people will have 16, but they might have a boost of 4. So I would say that people who have those boosts of 4 tend to be at higher risk. And if they've done radiation again to the axilla or to the inguinal lymph nodes. So the inguinal lymph nodes are the lymph nodes on the front of your thigh where you'd see the crease when you bend your hip. So that crease are called those inguinal nodes. If they've done radiation there, then you are at increased risk. If you've had post-operative wounds, infections, or been on antibiotics throughout your cancer treatments because of infection, then you're at increased risk because the infection can create more damage to the surrounding lymphatic vessels in the area. If your post-surgical drains were in longer than the normal 10 to 14 days, you're at increased risk. If you don't have full range of motion or mobility of your shoulder, or let's say you've had deep abdominal dissection. If you don't have full range of motion of your hip and mobility for walking, and those types of activities haven't returned, you're at increased risk of lymphedema. And then obesity is definitely an increased risk because of the fatty tissue that sits around the lymphatic vessels and lymph nodes and prevents their proper contraction. This is just a picture of somebody with lymphedema. So you can see the lymphedema in her right arm that's quite extensive. And then after she had decongestive therapy, that's the other picture and showing that it reduced quite significant with her decongestive therapy, which I will talk about. The stages of lymphedema are important to know. Early subclinical stage is there is no visible swelling. There's a feeling of tightness, heaviness, tingling, pins and needles. This can go on for months, sometimes even years, but this is the early subclinical stage. So you have symptoms of lymphedema, but you don't actually have a visible swelling. That is the stage in which we want to start treating patients because we want to try and prevent the progression to stage 1, which is when you start to see visible swelling. And so in stage 1, you have visible swelling. You might have soft pitting edema so that when you put your finger on your leg or on your hand, typically on the top of your foot or the back of your hand, your fingers would sink into the tissue and it would actually leave the imprint of your finger. That is when you're in stage 1. So it's very early on. Elevation often helps. So if you put your arm or your leg on a pillow, or you have a good restful sleep that night, often the swelling does disappear. Again, we want to catch people in those stages because we can prevent it from progressing. And then treatment is a lot less extensive, and it can often be helped by a few treatments, but putting people into a compression garment. Stage 2 is when limb elevation no longer helps. So after a good night's sleep, you still notice that your foot and your hand are still quite swollen. And the edema at that point, the swelling at that point can be pitting or non-pitting, and you can start to develop hardened areas. So sometimes people will say it becomes very hardened in their forearm, the tissue's getting thicker, they can't sink their hand or their arm into their arm or their tissue. That's when we know that it's progressing. And stage 3 is when the limb is very large, and the tissue is very hard and dense and extremely unresponsive to easy treatment, that's often when we have to do quite extensive bandaging at that point. There can be skin changes. It's called lymphostatic elephantiasis. The fluid really isn't moving. There can be redness to the tissue, thickened skin, creases, lobules leaking from the skin. All of these things can happen if it progresses to stage 3. The goal is to never see patients in stage 3. It's to see patients as early as possible so we can prevent the progression. And we know that we can prevent the progression with proper treatment. The problem is patients are often not accessing proper treatment because cost of treatment is so exorbitant, and I completely understand that. So self-management at that point is going to be extremely key. The signs of onset of lymphedema, again, that heaviness, tightness, bursting sensation, increase in size of the limb, puffiness, sometimes a feeling of heat or warmth in the skin, shooting pains, pins and needles, clothing becomes tight, jewelry doesn't fit. Everybody has a Fitbit lately or an Apple Watch. These Apple Watches are leaving indents on people's wrists or arms. That is a sign of onset. If you have lymphedema, signs of worsening are recurrent infections. These infections are called cellulitis infections. The skin becomes very red, very hot, and people develop fevers and flu-like symptoms. It's worsening if your compression garment doesn't fit or it fits too tightly. You're developing pins and needles into the fingers or toes, or numbness in the area of the limb. The skin is becoming thick and rough. There's getting discoloration or blister-like nodules on the skin. Again, fibrosis, leaking from the skin, or a decrease in mobility or function of the extremity that has the swelling. Other facts that I think are important is not everyone who's at risk of getting lymphedema will develop it. Okay, so we're saying 15 to 20% of cancer patients. Definitely some groups have a higher rate of lymphedema, melanoma patients, gynecological cancer patients, especially the ones who've had radiation to the abdomen. And breast cancer patients are obviously the groups that are the highest, head and neck as well. So I don't want to forget that group, because about 75% of head and neck cancer patients will develop lymphedema, usually post radiation treatment. Some develop it right after, some will develop it years later, and those at risk should take measures to try to prevent lymphedema. And there's starting to be more and more research on prevention, which is amazing. And can provide a lot more hope for people that if they get early diagnosis and intervention, that hopefully they can prevent things from progressing. The treatment of lymphedema is really important. There's starting to become a lot more buzz about manual lymphatic drainage, and everybody will see that if you go on Instagram and TikTok and YouTube, there's all kinds of videos out there. It is so important to see a certified therapist. So you want to find someone who is CDT certified. They've taken special training to deal with lymphedema. A lot of the clinics that are out there, spas are starting to say they do manual lymphatic drainage. A lot of these places don't have someone certified. They're trained in doing manual lymphatic drainage for the healthy individual, not for someone who's had cancer or who's had lymphedema because of other reasons, like trauma. So the purpose of treatment is really to reduce the limb swelling and then maintain the reduction of the volume. And we're really redirecting fluid away from the area and into healthy lymphatic pathways. So when you've had cancer treatments like radiation, wherever the radiation has hit, we usually view those areas as damaged in terms of their lymphatic system, especially at the initial lymphatics, which is at the skin level. And so we want to reroute the fluid away from those damaged areas into healthy lymphatic pathways, so that those healthy lymphatic pathways can become stronger and they can start to pick up fluid a lot faster. And I almost call it like retraining your system, kind of like muscle memory in sport. There's also muscle memory in lymphatic vessels, because the lymphatic vessels do contain smooth muscle. And so if we keep stimulating the healthy pathways, we know that we can create lymph angiogenesis, which is a strengthening or more lymphatic vessels in those pathways that are healthy so that it can then draw from the area and move fluid out on a normal basis on its own. And, it's this phenomenon we see in the clinic when we see patients for a prolonged period of time, that all of a sudden their arm lymphedema or their leg lymphedema, it's just not returning back like it used to summer after summer. And I think that's because we've created some lymphangiogenesis in the area, because patients have become so good with self-management, self-MLD, using compression garments, having a good exercise routine, and they've actually helped create new lymphatic pathways that are just stronger for their system to reroute the fluid on its own. And so, they start to need a lot less treatment from us, which is amazing. So the treatment is called combined decongestive therapy, or you might see certified lymphatic therapists. That's okay. Those are, legitimate people out there providing this care. And it should include education, skincare, compression therapy, manual lymphatic drainage, and exercise. It should include all of these things. The education component should be about the lymphatic system. If you understand why the swelling is occurring, I find patients do a better job at their own self-management. When you understand why things are happening, you're more likely to take control of the situation. Knowledge is power, and the more knowledge you have on a chronic illness, the more power you have over it. Don't carry heavy bags or heavy purses in the arm where you've had lymph nodes removed. For leg lymphedema, don't wear tight shoes that are pressing on your toes and squeezing your feet in and creating bunions and all these other things, because that's also just creating more damage in the area. Take more rest breaks when you're doing repetitive activities. For people who are doing a lot of walking, if you find that you need more rest breaks when you're walking, then take more rest breaks when you're walking. Don't use hot tubs or saunas. Avoid extreme cold or heat like ice packs. This swelling will not resolve by putting on an ice pack on it. And often patients will say they notice some swelling in their wrists, so they just put a little bit of ice on it to see if it would get better. Often you'll get a rebound swelling, so you'll get a lot more swelling when you remove the ice pack. And those at risk or with lymphedema need to use compression garments or bandaging when they're traveling by air as a preventative step. The research is really out on that. It's just something that we've done for years and years and years. And, the question is, does it really prevent swelling when you fly if you wear a compression garment, if you don't have lymphedema, but your risk is there? We're not sure, but for some patients, it's just peace of mind if they take it on a flight with them. Skincare is extremely important. You need to use lotions on your skin. Often the area where you've had a radiation and the limb where the lymphatic or the lymph nodes have been removed can be very dry skin. Patients will report that. They'll say the skin is always drier on my right leg than my left leg because of all the swelling, or, my right arm is always drier than the left. And that's simply because of the swelling in the area and also the lymphatic damage. So you need to use lotions with a pH of 4 to 6. And I give lists of lotions and products from the research that I did for the book. So there's lists in the book about the products that are the most beneficial for getting that pH of 4 to 6. But often Lubriderms, Avenos, Eucerin, CeraVives, like these products on the market that are unscented are good. You're trying to prevent skin damage, so you don't want cuts to the skin. Don't cut your cuticles when you get pedicures or manicures. No extreme temperature changes, no blood pressure cuffs or needle draws, acupuncture needles on the area where you have lymphedema or are at risk. Use bug sprays in the summer, use sunscreens to prevent sunburns in the summer, because that can also damage the layer of skin and cause lymphedema. Avoid using razors to shave, use electric razors instead so that you don't cut yourself and possibly cause an infection in the area. Take care again, cutting nails, no cutting cuticles, and don't wear tight jewelry. Get jewelry that is fitting you properly, and get rings sized a little bit bigger if you need to. Manual lymphatic drainage is an important component of this treatment as well. It's the massage people talk about. I don't like to call it massage. because then everybody thinks it's a spa type treatment. And really, manual lymphatic drainage is a very systematic treatment done to stimulate the lymph nodes and the lymphatic vessels in a sequence. And so we will start at the neck and work our way down the arm and work our way back up depending on what we feel in terms of skin stretch. And the purpose of this is really to reroute the lymphatic fluid, like I said, to alternative pathways or healthy pathways in the area to improve lymph return to the bloodstream and send it back to your regular circulation. And then we want to do this manual lymphatic drainage as a necessary component of treatment, and that compression on its own often doesn't do the trick. So sometimes people will say they've used a compression sleeve and their arm never changed at all. And that's because I say you haven't stimulated the lymphatic vessels and the lymph nodes to contract and relax at a faster pace in order to pick up the fluid when you do have your compression sleeve on. Compression garments are simply designed to prevent you from getting bigger, and they're fit for the size of limb that you have, which is why it's important when you go to the compression stage that if you are very swollen, and I usually say 3 centimeters or more swelling in your lymphedema limb, I would put you in the active phase of treatment, which is the reduction phase. That's where we're doing 3-layer or multi-layer compression bandaging. And when we do multi-layer compression bandaging, we're doing very frequent, close together, teaching patients how to do it too. You're keeping it on 23 hours a day. And that is a picture of a patient of ours who was bandaged with multi-layer compression bandaging. And this is done to reduce the size of your limb because we can change the circumference of the bandage as we're putting it on. When you go into the maintenance phase, that's when you then go and get your compression garment from your compression fitter and get fit for something that now fits hopefully a smaller limb because we've reduced the size of the limb. And compression garments, there's custom compression garments, there's over-the-counter compression garments. Their job is to maintain the size of your limb in between your intensive phase. Compression sleeves, there's gloves, there's stockings, there's open toe, closed toe. We can put pads inside gloves if we have to. The sky is the limit for compression garments. If you can't get the compression garment you originally fitted for on, then we need to come up with something that you can put on. So sometimes people need a pantyhose, but they can't put them on. And so sometimes what we'll do is we'll get them a knee high and then we'll get them a capri so that there's something covering the entire leg, but it actually comes in 3 pieces. And that can be very, very helpful for patients to get on. Sleeves, also the same thing. Sometimes people can't get on a circular knit sleeve and they need a flat knit. Then we have to go the route of choosing a flat knit. And so there are all these options. Your lymphedema therapist and also the Sunnybrook lymphedema team. I know a lot of the patients on the Wellspring program are going to be either with Sunnybrook or Princess Margaret, and they have a lymphedema group of nurses and therapists at the hospitals who often give the ADP forms out, and they should be helping select what type of garment you go in. The assisted devices program is a program that covers compression garments for every 4 months. You can get 2 sets up to 75%. And every 2 years, it has to be signed by your family doctor. The initial application has to be signed by your specialist, and everybody who has lymphedema should get into this program so that you have coverage of compression garments for the rest of your lives. Exercise is a very important component of CDT. It helps to improve lymph and blood flow. It helps with joint range of motion. It helps with your muscle strength. And the stronger your muscles are, the more contraction you'll have for those lymphatic vessels and the more lymphatic fluid it can help pump. So weight training is okay for people who are at risk for lymphedema or have it, but you need to find a therapist who understands this and will educate you about how to do this safely, because you can't just go all out into exercise if you're at risk of lymphedema. We have to very slowly progress you, and it needs to be a slow progression of exercises as well and repetitions. And then, exercise helps maintain a healthy body weight and a healthy mindset. It helps keep our minds healthy too. And we add in lymphatic taping. So now I'm going to talk about a couple of things that fall outside of CDT. So lymphatic taping is one of those things. This is a patient with legs taped for swelling behind the ankle and on the top of the foot. And this is a patient with taping for swelling on the front of her wrist and in through her hand. And this lymphatic tape is really sports tape, but it needs to be applied in the correct pathways along lymphatic zones. And it needs to be applied correctly so that you are stimulating lymphatic flow. It can't be applied without the therapist having knowledge of how the tape is used to stimulate this lymphatic flow. And the tape can stay on 3 to 5 days and can often be used for places that are really hard to compress. So you can see this patient, it's used in the neck for head and neck swelling and can be quite helpful for those people. Another thing is deep oscillation. So we're starting to use deep oscillation in our clinic. We've maybe had it for about 3 weeks now. And it's really an electrostatic pressure that's helped creating vibration to the tissue. So it's a very local vibration. And we are finding it helps stimulate some lymphatic flow. It's helping with fibrosis in the area. But it is dependent on stimulating the lymphatic pathways before we use the machine, and then applying the machine along the correct pathways and in the right direction to actually move the fluid out. And actually patients find it to be quite a relaxing treatment and are finding their limbs to be quite light after therapy, which is amazing. So we're happy that we have started using this. And so we'll continue to do our own research on how it will affect our lymphedema patients. And prevention of lymphedema. So there are a lot of studies being done on prevention. Prevention is possible, but I think more studies have to be done. The key is early detection. The earlier the stage that we get it, the more likely we are to prevent it from moving on. And, they're doing some studies on, patients who have swelling for a very, very short period of time in the back of their hands. So those stage 0 patients or stage 1 patients. And if they put compression garments on those patients for about a month, they were able to prevent their progression for at least a year after surgery, which was amazing. And our hope is that there'll be more research in terms of prevention and what prevention would look like, because we don't know how long do you leave somebody with a compression garment on for prevention if they've only had swelling in the back of their hand or heaviness for, let's say a day or two. Do we leave them in the sleeve and glove for a month, or do we leave them in it for a year or 6 months, really to prevent progression of their symptoms? This is the book that I wrote called The Complete Lymphedema Management and Nutrition Guide. You can buy it at any major bookstore, on our website, Amazon, Chapters, Barnes and Noble, anywhere. And this is information to reach me. You can reach me at Markham Lymphatic Center. You can go to our website and find us. Sorry, I know it was pretty quick, but I had only 40 minutes to talk about a lot of things. So hopefully we can answer some questions now.
Thank you so much for that, Anne. So I know we covered a lot of great content, and I hope you did find it informational and educational. So we're going to open up our Q&A segment now. So at the bottom of your screens, you should see just a reminder, it's an icon that says Q&A. It's like 2 chat bubbles. So if you have any questions, please type your questions in. And I know we've got a few minutes left, so we'll try to get to as many questions as we can. So Anne, I'll jump right into the first question that I have. What advice would you give to someone with both arms affected by lymphedema for getting blood work or blood pressure taken?
So it is really tricky for people who have bilateral arm lymphedema. I often say, pick the side that's less affected. I did read the question though, and I think she said that her left arm is the side that she's trying to get them to use because she has a blood clot on her right side. And it's extremely tricky. You can see if they can do this using your leg, because they can take your blood pressure using your leg, but it's not easy. And you can also do blood work through through a leg vein as well. Again, not easy, and more complications that can come with it. So unfortunately, blood work is necessary, and so is taking your blood pressure. So, you know, I would say life-saving techniques have to be done, and it is necessary even if you do have lymphedema. But I'm wondering, like, if she's using a compression garment, maybe applying that compression garment right after. I don't know the situation. So using compression might be a good, helpful solution to preventing it from getting worse after. Doing manual lymphatic drainage after could be a helpful solution as well.
Okay, thank you for that. So our next question, so cancer patients that have finished treatment but then develop neuropathy, but also have severe swelling in the legs, do you think this is a possibility of lymphedema?
Yes.
Mhm.
So unfortunately, we know that especially the cisplatin, certain types of chemos can cause damage to the lymphatic vessels as well and cause lymphedema. So we do know that some of the chemotherapies do create some lymphatic dysfunction as well. So sometimes we are seeing secondary lymphedemas in the legs for patients with breast cancer. So important to get treatment for that.
Mhm. Thank you for that. Our next question, so for someone, for members that do experience blood clots in their legs as a side effect of chemo, could lymphedema be a factor for this? And what would you suggest, I guess, the kind of questions they would bring up to a doctor if they're asking about this?
So I think what I would ask the doctor is, you know, what are the side effects from the medication? Do they think that this could be causing your swelling? You know, should you go out and get treatment for your swelling? Compression garments can often help as well with that type of swelling, especially if it's soft pitting edema. You know, you also want to know when people have a lot of leg swelling, how their heart is doing, how the other organs are coping. And I'm sure the medical team is constantly monitoring. They're constantly monitoring your liver and kidney function. So I think just questions to ask if this could be coming because of the chemotherapies. It's often the taxane group of chemotherapies that cause that type of swelling, but it is swelling is often the side effect of many of the chemo medications out there.
Mm-hmm. Thank you for that. Yeah, I think that also answered to some degree. We had another question that came out about what type of chemos, and again, it's harder, I know, to specify, but I think you've answered that one as well. So our next question, and this is a question, I guess, on a possible symptom, if it is a sign of lymphedema, are pruny fingers. So say, you know, your hand has been in water too long. Is that a sign potentially of lymphedema?
No.
Okay.
No, so that's not a sign of lymphedema.
Mhm.
I would say it would be, you know, if you had swelling outside of water. Prune fingers is what we all get if we stay in the water too long.
Okay, perfect. Thank you for that. So if someone had, we've got a question, someone had surgery a week and a half ago and are recovering, how soon would you expect to see symptoms of lymphedema develop if it does, or is there no timeline for it?
So there's really no timeline. The only thing is early post-operative and early after radiation, usually the first, 6 weeks to 3 months, we would consider that post-operative swelling or post-radiation swelling, because that can occur. And so we wouldn't jump to the conclusion of calling it lymphedema. However, you can also get treatment for that if it's significantly bothering you. Like if it's causing a lot of pain, a lot of discomfort, it's hard to wear clothing, hard to, wear a bra, hard to put on shoes, like these types of things, you can still get treatment for that. And the hope is that just sends that fluid back to your lymphatic system. But at that point, not necessary to get treatment unless there's a significant issue.
Mm-hmm. Okay, thank you for that. And so I guess we have someone joining us from British Columbia. So Dolores, you both might be able to chime in here. Is there a program or resources specific to British Columbia for lymphedema that members might be able to access?
Yep, there's a lymphedema association in British Columbia. So you can just Google that association and contact them. And then they'll have a list of also therapists and resources in the area. And they're quite a helpful group.
Okay, wonderful. Thank you for that. So in regards to travel, so we've got someone driving to Florida, lymphedema on their left leg. So I guess a more general question that might apply to others joining as well. Do you have suggestions for how people might take care of their lymphedema while they are moving on the go? Compression socks, is that
So I think when you're out and about, you're taking long car rides or airplane trips, those types of things, take rest breaks, stop at the rest stops, go for a little walk around the building. Make sure you're drinking adequate levels of fluids still, because when you dehydrate, your lymphedema can actually become worse. Use your compression garments properly. It's a long trip if you're going to do it all in one day. It's going to take you over 20 hours to get to Florida. Maybe think about staying overnight halfway so that you can get a decent night's sleep. It's so important just to try and take some precautions to just give yourself some mobility. Mobility is key when you're stuck in a seat for that long.
Thank you for that. I see a question referencing, can you show the screen with the book? So Anne, I don't know if that was your book that they're referencing. If you wanted to just give the title, I could pop it in the chat as well, whatever's easier.
So the book is called The Complete Lymphedema Management and Nutrition Guide. Do you want me to pop the screen back up?
Yeah, we could do that for a second and then
okay,
people can take a note of that one.
Let's see. I'll go back. There you go. The Complete Lymphedema Management and Nutrition Guide.
I don't think you're sharing. I don't see it.
Sorry. Of course. Let me go to screen share. Sorry.
Oh, no worries.
All the things we have to do, right?
You gotta love tech.
Did you see it there?
Yeah, so I see your last slide now. I think it's just the one right above that one.
I'm gonna go from the beginning. I'll get there. There you go.
Perfect. Amazing. Yeah. So we'll keep this up in case anyone is interested in following up with that one. And so I'll go to our next question. So I think someone was Googling resources in Ottawa. So are you able to explain what VODDER certified is? I hope I'm saying that. VODDER.
VODDER certified therapist would be someone who's a lymphedema therapist. As long as they went through and did their complete training, they did all 3 levels, then they would be a VODDER trained therapist, and that would be a lymphedema therapist. Yep.
Okay, perfect.
And then, don't feel afraid when you call somewhere, ask them if they have the certificate that says they are a certified lymphedema therapist. Make sure they're not lying to you. If you're using lists from Sunnybrook, you're using lists from the Lymphedema Association of Ontario, you're using lists from, the BC Association. Our association, especially the Ontario Association, I can't speak to BC, but I can speak to Ontario. We make sure as an association that the therapists send us a picture or a copy of their lymphedema certificate that says they are certified. So they're not on our list unless they're certified. And that was always one of the mandates of the association, was to make sure that patients got connected with proper healthcare workers that were effectively trained that can manage the condition. So ask, and don't be afraid to ask, because you're going to be paying for treatment anyway. So ask and always demand the best care. Advocate for yourself, always.
No, and I think that's such a powerful message, and it's so important, I think, to hear that too, because sometimes, it can be scary or overwhelming if you don't know the right questions or who to ask, how to ask. So it's always a really good reminder to hear.
And I always find, patients always think they're going to be insulting to us if they ask us. And I always say, good for you. You're so resourceful. This is amazing to be resourceful and know what you're looking for. It's a very, very good thing. It isn't a bad thing at all. And so those therapists out there like us who are all certified and, trying to promote adequate treatment for this condition are all encouraging our patients to keep advocating.
Thank you for that. So I think we're going to get to one last question before we do wrap up. I'm mindful of everyone's time. So For individuals who've had surgery, so in this case, it would be a bilateral mastectomy. Right side still has fluid moving around, hasn't been absorbed. Is this something to consider as this person being at risk for lymphedema, or?
So, I mean, it depends. I don't know how long post-op it is. So early post-op, you can just have post-operative wound swelling or tissue swelling in the area. And then again, if they've done radiation, then you can have swelling again after they've done radiation. So I'll use just, let's say, a person who's just had surgery, they're waiting for radiation, they haven't had radiation yet. I see those patients in our clinic because I don't want the radiation to cause lymphatic damage in the area and cause the swelling to become worse or progressively get worse. But swelling, moving around in the area, squishing around in there, I would say, lymphatic drainage sessions are going to help you just move it out fast, and then learn how to do this treatment as well, so that you can do some management at home. I don't know where you live, so always ask your therapist. Self-management strategies should be a component. It's always a component in a clinic. If it isn't a component of the therapist that you're seeing, just ask them, say, what can I do at home to help myself? Because I always view it as your lymphatic system is deficient every day. It's not just deficient on the day that you come and see me once in a week or once in a month. It's deficient every day. And so in order for you to really gain ahead of, get ahead of the swelling, you have to do some self-management every day, especially at the beginning, when you're learning about how to manage this and how it feels to be reduced. So yeah, I think if fluid is squishing around in there, then it could be lymphedema, especially if it's 3 months post all of your cancer treatments.
Thank you for that. So I think that wraps up our Q&A segment for today. But again, I just wanted to take the time to thank you all, Anne, Adriana, and Dolores, for your time today and sharing your knowledge and your experience and the lived experience as well. I know it's very powerful to hear from someone who has been through it and encourages that advocacy as well. So I'm very thankful that we had all of you on board with us today. I just also wanted to remind everyone who is online. So Jean Lamantia, who is also one of the co-authors of the book that you see on the screen here, she will be joining us next week, 11 a.m. Next Monday for part 2 of the lymphedema series, going over diet. So if you do have the time and you are interested, we'd love to see you online for that as well. So just another note as well, this webinar is being recorded. So if you want to go back to see some of Anne's strategies or anything like that, we will have the recording posted on our website in a few weeks. So just wanted to remind everyone of that. And Dolores, Adriana, did you have any final comments for us?
Only that I put in the chat that we maintain a current list of therapists that are trained. And as Anne said, everyone who's a member of the LAO, a massage therapist or a physiotherapist, we check their certificates and we maintain a list. So if you live in Barrie, you could just go in there, type in Barrie, and the people who are members and who are trained come up there. And we also maintain a list by name, so it's very easy to find a trained lymphedema therapist.
As the only other thing I wanted to add is that it definitely pays off to be a member of LAO. Again, I'm responsible for advocacy, so I have to encourage people to become members. There is a lot of information that LAO makes available to members, a lot of webinars, and it's webinars about new developments, new materials available, and as this condition becomes more relevant, there are places where there are real news about it, and we try to bring news from all over the world the best we can for people to be informed. So I definitely encourage everybody who is affected by this condition to join us as a member with LAO. And thank you very much for listening to us.
Thank you so much for that. So I just saw a note here, a comment that might be helpful for individuals. So one of our members let us know that there are 15 copies available to borrow at the Toronto Public Library of the book that Anne showed earlier. So in case anyone is having trouble accessing that, that's also another alternative. So I'm seeing, oh, a great comment. I just want to read this last one. I did say a lot of comments saying this webinar has been very educational and informational. I see a comment that says, thanks for hosting these workshops. Until I found Wellspring, it's been hard to find reputable information online and know which sites you can trust. So I just wanted to thank all of you for taking your time to join us, our presenters as well. So we know that members are getting the most expert, knowledgeable, and credible information that we can. So thank you so much for all your time today. And we'll see, hopefully we see some of you online for next week's webinar on Monday as well. So thank you and take care, everyone.
Thank you.
All right,
Thanks,
bye.
Thank you.